We are live. Live video is starting. I hope that everybody's okay. Good. You're now live. Great. I hope everybody's well. Hello, hello. Okay, great. Yeah. Okay. So, pinned to this live is the empowering potential. It's the dyslexia webinar that is going to be Saturday, September 14th. I'll mention it again. It just popped up. So please register for that. And welcome, whether you are coming in live or watching the replay. I'm glad to be live. I haven't gotten on live for a couple weeks now. So I hope the beginning of the school year has been good for everybody. So we're after Labor Day, and at this point, right, today's September 5th, we're after Labor Day. So about everybody in all 50 states should have begun school at this time. I'm going to assume that everybody has begun school, the school year, at this time. Let me know if you haven't, because that is a bit odd. Connecticut has certainly started before Labor Day. Massachusetts is starting this week, and New York City has started today. I think kids went back today. I think teachers went back Tuesday. I work all year round, so I love to know when people are getting back into the flow of things. I'm happy. So if you don't know me, my name is Imari, and I am a speech language pathologist, educational leader, and special needs parent coach. I'm the administrator in this group, Special Needs Supermoms. So welcome everybody who's new. There was a point that the group was growing and just had a little bit of people, and I knew everybody. Now I don't know everybody anymore. So hello and welcome. Tonight we're going to be talking about dyslexia. I know that there are a number of moms in the group whose children have been diagnosed with ASD and dyslexia, or dyslexia just by itself, and so we'll talk a little bit about it. I want to remind you that this is sort of a segue into this month's webinar, Empower Potential, which is a webinar on how to support young readers with dyslexia. So in this live, I'll be talking about signs and symptoms. However, I will not be talking much about strategies and how to help and empower your young reader with dyslexia, because for that you need to sign up for the webinar. So I hope that I see some of you there. Okay, all right, so dyslexia, what is it, right? Let's start there. So the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders, this is what most clinicians use to find the diagnosis that matches the criteria that they see. We're on the 5th edition now. Every couple of years, it gets peer reviewed, and we get a new edition with new diagnoses and new verbiage around what clinical indicators may mean. And so we're on the 5th edition at this point. So the DSM, that's the acronym, the DSM-5 describes dyslexia as an inaccurate and effortful word reading difficulty of understanding the meaning of what is read and difficulty with spelling. Okay? I'll say that one more time. And I'm looking down because I'm looking at my notes. The DSM defines dyslexia as an inaccurate and effortful word reading difficulty of understanding the meaning of what is read and difficulty with spelling. Okay, so in this definition, we recognize that individuals with dyslexia have a hard time decoding which is reading, and encoding, which is spelling sounds, right? So fundamentally, there's an issue with manipulating speech sounds, okay, when they are presented as written text. So, special criteria that distinguish dyslexia from other print-based disorders and other language-based disorders are that dyslexia difficulties have persisted past 6 months, right? So that means you see this inaccurate effort in word reading and in spelling and understanding for more than 6 months with intervention, right? So if there's intervention consistently going in place, the child is being helped, they're getting support that they need, and they still cannot read, spell, and understand, right? There's no comprehension. For more than 6 months, we say that that is a special criteria that is a red flag. Also, if they remain below age expected peers for more than 6 months, that's also special criteria that distinguishes dyslexia. And so really, teachers, I'm going to say, and maybe therapists would recognize that, because they're watching the whole class move at the same time, and they're seeing that 1 or 2 students who demonstrate criteria of dyslexia just staying behind and not moving forward and progressing in reading with the rest of the class. So, comorbidities of dyslexia. And so let's just stop there. What's a comorbidity? A comorbidity is our 2 diseases that are occurring at the same time, okay? So, sometimes we see dyslexia occurring with ADHD, and we see that in 20 to 40% of children that ADHD and dyslexia are happening at the same time. ADHD, being attention attention deficit hyperactivity disorder. So we see that in 20 to 40% of children who have both dyslexia and ADHD. ADD, right? Attention deficit disorder, meaning there's different from ADHD because there's no hyperactive component. We see that. I don't have a percentage of the comorbidity, but they can exist together. Tourette's syndrome, right? OCD, obsessive compulsive disorder. We see that. We see those 2 together. Dyspraxia. You can let me know in the comments, or you can let me know privately if your child has been diagnosed with dyspraxia. Overall, that means discoordinated muscles, okay? When we talk about motor development, and this is just a brief aside, when we talk about motor development, usually we're looking at strength, coordination, and range of motion. Those 3, always. Those are the 3 most important things we're looking at when we're talking about muscle development, muscle movement, muscles. And so dyspraxia is just poor muscle coordination. It could be gross motor, it could be fine motor, it could be both. We see dyspraxia and dyslexia together 85% of the time. Okay? Asperger's. So 1 out of 7 children with Asperger's has dyslexia. And so I have seen it in my clinical practice, and I have heard it anecdotally. Parents tell me that their child who's on the spectrum also has been diagnosed with dyslexia. I am assuming that it is difficult to really say how much the percentage of children that are on the spectrum and have dyslexia, because when we say when we talk about the comorbidities, and ASD is one of them, it's really most helpful to say where on the spectrum they are, okay? And so here we see that 1 out of 7 it has with Asperger's also present with dyslexia. Now this is interesting, the next 2. 50% of language disorder have dyslexia. So children who have been diagnosed with language disorders by me, by a speech pathologist, also have dyslexia. Inversely, 50% of children who've been diagnosed with dyslexia also have a language disorder. Okay? And so decreased speech and language is a red flag for dyslexia, right? I would even go as far as to say that a child who is presenting with a speech and language disorder should later be followed up with, depending on their age, should later be followed up with dyslexia screening. I would say that. And that's because so much of dyslexia, so much of reading is language-based, print-rich, text-informed, and so those are features that then present themselves as deficits in dyslexia. But the research is saying 50% of children with a speech and language disorder have dyslexia. That's a lot. And 50% of dyslexic have a speech and language disorder. So these are our comorbidities. Okay, let's move on to the early predictors. I have 6. 5 are really pertinent to the conversation. The last one is important too, but it's really very general. And so the title of this live, Signs and Symptoms, these are our signs and symptoms, okay? The early predictors of dyslexia. What are they? So just like we learned in our comorbidities research, poor speech and language development is a early predictor of dyslexia, okay? So if your child is classified as needing speech and language therapy, there is a 50% chance that they may also be dyslexic, okay? Whether that they're identified or not, they may be dyslexic and struggle with reading. Number 2, poor visual spatial attention is an early predictor of dyslexia. And that's because reading relies on fast visual processing. What is visual processing? It is the way that we perceive information that is visually presented, okay? And so letters, words on a page, a field, right, laid out from left to right. A child with visual spatial deficits really has a hard time orienting themselves to that map. And so poor visual spatial really does show us that is an early predictor of dyslexia. Okay, number 3, nonverbal intelligence is an early predictor of dyslexia. What does that mean? Without the use of verbal language, using visuals or hands-on reasoning to solve problems. That's what nonverbal intelligence is. The use of nonverbal language to complete hands-on problems and hands-on reasoning and to solve problems. So nonverbal intelligence low nonverbal intelligence is an early predictor of dyslexia. Okay? Now the next one is very interesting. A discrepancy between reading achievement and IQ. So achievement and IQ are 2 different things. Our IQ, our intelligence quotient, is sort of what it is. It's what we're born with, and it doesn't change for life, okay? So 85 is normal, average. Last time I checked, I looked at a WIPC, a Wechsler. So what we're born with, what your IQ is, doesn't change. But your achievement and your performance could change. So you can always get smarter, right? You can read more books, you can increase your vocabulary, You can take classes. You can always improve achievement. But IQ is set at what it is. Your intelligence quotient is what it is. And so when there's a large discrepancy, that is an early predictor of dyslexia. However, the children that demonstrate this point right here, that have a large discrepancy, so they might have a high average and above IQ, but very poor reading achievement. It's actually their high IQ which acts as a safety net and helps them to remediate with intervention. Okay, so studies show reading difficulties coupled with high IQ are a red flag for dyslexia. This is because IQ is composed of working memory. Yeah, so I get evaluations all day, every day. I get so many. I get entire packets from psychologists. It's tremendous. Anyway, most of them for pre-K, from the pre-K students that I review, they are given the WIPC, okay? And one of the subtests in the WIPC is working memory. And working memory is part of our short-term memory and is concerned with immediate consciousness, okay? And perception and linguistic processing. And so when children have a poor working memory, or you could just think of it as short-term memory, when they have a low short-term memory and poor reading comprehension, we expect we expect features of dyslexia to present themselves, and we expect them to be difficult to remediate. But if they have a high IQ and they have a very good working memory, it almost kind of becomes their saving grace in being able to memorize different things as they relate to reading instruction. Okay? Last early predictor of dyslexia is poor working memory. So that was a very good segue into the next thing. So give me one second. So once again, working memory is part of short-term memory that is concerned with immediate consciousness, perception, and linguistic processing. Working memory is considered a predictor of reading dyslexia in children. So working memory is very important, and it is probed in most psych assessments. Even in speech and language assessments, it's not called working memory, but there are a lot of, I'll say the test that's the gold star for school-age children does ask them to listen to a sentence, listen to sentences that are short, and then increase in length and linguistic complexity, and then repeat them back. So working memory is very important for reading acquisition, and poor working memory overall is a early predictor of dyslexia. There's something else that the working memory is connected to the phonological loop. So a lot of speech sound acquisition is dependent on the working memory. It has a lot of features and functions in learning to read. And so when it's malfunctioned, when there's a deficit of some sort, it's going to impact the child's ability to read, okay? So lastly, because I said that there are 6, most children with neurodevelopmental disorders may, they are sort of on the radar for dyslexia, and screening and additional observation should be employed with them, just because their developmental disabilities make them at risk for dyslexia, and certainly at risk for poor reading acquisition. Now, something interesting that the research highlighted is that dyslexia is usually identified between 2nd and 3rd grade. However, the most intense reading instruction is given between kindergarten and second grade. So by the time the child is identified as being dyslexic, that the window, right, for reading acquisition and all of the time and the resources in school really have ended. So it's important to know the early predictors, and it's important to know strategies on how to help your child to read. It's also important to be in communication with the teachers, because you may see something that they don't, and really to get the diagnosis and to get the intervention early. That's really key. So that's what I have tonight on dyslexia signs and symptoms. I want to tell you guys that a couple announcements. Number one, bundles are out. Bundles are ready. I have, for every single month for the past year, given a webinar on different topics. The first 3 webinars were on language, the language of neurodivergent children, and then strategies on how to help them to speak, right? And how to help them to listen. And then we moved into bilingualism and the different features of bilingual development and neurodivergent bilingual development. And then in the spring, we worked on autism, spectrum disorders, social skills, eating and feeding, and a couple of other things. And then this summer, we worked on literacy. I gave a webinar every single month on literacy. So every 3 months, there was a different theme. So those 3 months, the webinars for each of the 3 months, I have bundled into a course for you guys. I have put the link in the chat earlier this week, but I'll put it again. I want you to take a look at these bundles. They are so informative. They are so good. The research is fresh. It is new. It is cutting edge, right? If you put on your earpods and you sit and you listen to the bundles, right, the packages, you will learn so much, Mom. I promise you. You will learn so much, and you will learn so much on how to help your child, all right? It will change your parenting. It will change your perspective. It will change your whole approach. And it will make a very big difference on their outcomes, okay? It will change you, which then you will operate differently with your child and make a big difference in their progression. So please, take a look and purchase your bundle. That's what I have to say about that. Next, I have expanded. So I am now licensed I've always been licensed in New York. That's where I'm from, and that's where I went to school and graduated, and I've worked there for many years. So I am licensed in New York, Connecticut, and now Massachusetts. I have partnered with some really wonderful charter schools, and so I have therapy and assistance there, and it's fabulous. So what does that do for you? If you live in New York, Connecticut, or Massachusetts, I am offering for the month of September speech and language screenings, okay? A screening is pre-diagnostic. It does not give you a formal diagnosis, but it is a pass or fail tool that will indicate to you whether you need to move on to a full and comprehensive evaluation. I'm doing this on the premise that private practice is private, okay? My private practice is Communication Resources. I have met a lot of parents that want to keep their child's diagnosis, that want to keep their records out of the school district and out of the insurance and the medical providers. And so they seek private practices to be able to help, to treat, and to support the child and the family. So for the month of September, I am offering for $100 a speech and language screening with a complete write-up, okay? I will administer virtually the assessment to your child if you live in New York, Connecticut, and Massachusetts, and I will give you a write-up and let you know. We've already learned that 50% of children with a speech and language disorder present as dyslexic, and 50% of dyslexic kids do have a speech and language disorder. So I think that the research is loud and clear, and that these speech and language screenings should really give you deeper insight and help you to know whether you should move forward with an eval or not, okay? It will give you nothing else but peace of mind and clear understanding. So I'm offering this for $100, and in addition to the assessment, or the screening rather, the write-up, you get to come to the webinar for free. You get free admission into the webinar, okay? It is a $50 value, something like that, and I'm offering it for $100. This is only for the month of September. We're at the beginning of the school year. We have 10 months ahead of us to do a lot of work and to get to the next level with things. So let's use our time wisely, and please reach out to me for a speech and language screening for children aged 5 to 21 living in New York, Connecticut, and Massachusetts, okay? So the bundles, the screening, the webinar. If you are not getting a screening, if you live in a different state and your child is dyslexic, you think they may be dyslexic, they're having trouble reading, you're hearing complaints from the teachers, you don't know what to do, sign up for this webinar. This is the last webinar I will be doing this year, okay? I won't be doing any more virtual sort of teaching for in this format for the rest of 2024. These webinars have been great. They've touched a lot of moms, and we've had so many different types of people come. We have had other speech pathologists around the globe, right? From the Caribbean, from Europe, from the UK, from Spain, Portugal. We have had dietitians come. We have had occupational therapists. We even had at our last webinar the CEO of an early childhood center in the Midwest. So, I mean, they've been amazing. Lots of prestigious people, people who care about children, moms, clinicians, professionals, teachers. It's been great. And they come and they bring their questions. So not only are you learning, you're bringing your questions. Please sign up. Do not wait. Okay? Let me think. Is there anything else? Oh, I'll come on next week. I've been invited to a conference to speak. The conference is in Maryland. It has nothing to do with speech and language therapy. It has nothing to do with special education. It is a women's conference, and since this group is special needs super moms, the premise of this group is empowerment. I want all of you to check out the Girl Live conference. I'll be doing an Instagram live with the CEO and the director of Girl Live. I'll talk about that next week, and we can meet again, and it'll be a fun time. So, and I'll have some flyer and some links out about that. But the most important thing is buy your webinar bundle. Sign up for a screening, and sign up at Eventbrite for the webinar. It is going to be very, very good. Okay, you guys, I have a link tree. You can find me. You can personal message me, and that's really it tonight. If I don't get on tomorrow, Friday, have a very nice weekend, and enjoy your time off. Once again, welcome back to all the students and to all the children. Keep up the good work, moms. So many of you are doing an excellent job, and you feel like it's a thankless position, but I promise you, you are sowing seeds that will last a lifetime, and you are building legacy in your child. So, everybody, have a very good night. Take care, and until we meet again, bye.